is Nancy Mercer. I'm the Director of Medical Imaging and Cardiopulmonary Services at Mercer Health. Our cardiac testing department includes EKG, Holter monitoring, event monitoring, echocardiograms, and stress testing. The importance of cardiac testing is to make sure that you have proper cardiac function. We do a multiple diagnostic tests that look for the rhythm of your heart, and that's what your EKG is. We also do that with our Holter monitoring. Our Holter monitoring is a monitoring of your heart continuously for 24 to 48 straight hours. And the physician goes ahead and looks at that information after the fact to determine if there's any abnormalities. Based on also why the patient is wearing a Holter monitor, they keep a diary during that time, and they report any symptoms. So the patient maybe has some issues during strenuous exercise, and the patient states that they're having palpitations or whatever. They can go ahead and go back to that exact date and time and look at the heart rhythm and determine whether there is some abnormality there that needs further intervention. With the event monitoring, that is a longer cardiac telemetry, and that actually uses people off-site in another area that review the telemetry consistently while the patient wears the monitor for 30 days. And that's for those people where a Holter monitor doesn't necessarily pick up any arrhythmias, but the patient still has some concerns or issues. Then we have our echocardiograms. Our echocardiograms is an ultrasound of the heart, and generally what we look at is the valves. You have multiple valves in your heart, so we're looking at the function of those valves and how well they're working. We're looking at the heart wall muscle movement and function while the heart is beating continuously. We take those images and we send those to the physician, and all of the cardiac testing is reviewed and interpreted by a physician, by a cardiologist from that point on. The cardiac stress testing patients, those patients are ones who report some intermittent chest pain or maybe even intermittent shortness of breath, where we're concerned about the blood flow to the actual heart muscle. So to make sure that that heart muscle is functioning appropriately. So for stress testing, we monitor the patients while they exercise. So we hook them up to the same thing we would for an EKG. So we're hooking them up to multiple leads. So what we do is we put them on a treadmill. Treadmill stress is what we do here. So we hook them up to the EKG. We monitor their blood pressure, their heart rate, their EKG rhythm while they exercise. We also do it with a cardiologist in the room, continuously monitoring the test. So as the patient exercises, we can tell based on their heart rhythm, their blood pressure response to exercise, and their heart rate response to exercise if we feel that there may be some concern about the blood flow to their heart. It's not a definitive, it's not a conclusive test. But if the physician is concerned that there might be some abnormalities, what that will then prompt is further conclusive testing, which is a cardiac catheterization. Now, we do not do cardiac catheterization or any interventions beyond that. So we can go ahead and get that initial testing done and then send them to, if need be, send them off to have their intervention done. So patients, after they have an intervention at another facility, they can go ahead and come back and do cardiac rehabilitation here at Mercer Health. Our cardiac rehabilitation program is a physician supervised staff, medical staff supervised exercise program that we utilize to get those patients feeling like they're back to functioning at their normal, their previous normal, or near their previous normal. So we educate them, we do counseling, we do stress coping skills and stress management skills. Every patient has an individualized program, so it's not a cookie cutter program here. The patients are brought in, they're evaluated, and they help the staff determine their goals as where they want to be when they finish their rehabilitation program. So maybe we have a patient who likes to hike and things like that, but they're nervous about doing it. We can bring them in and try and make them feel more comfortable to get them back. We have a large variety of patients who also come in who they need to get back to work, and they want to make sure that they're safe going back to work. So we do bring those patients in, and several of those, depending on the time they've been out of work, because of their intervention or issue. We individualize that program to try and get them back, but also get them back in a safe manner and in a timely manner, hopefully, to get them back to work. Once the patient reaches their goals, we generally call that patient they've graduated. So when you graduate from our cardiac rehabilitation program, we have a self-pay wellness program, and we offer wellness here multiple days per week for our graduates of the rehabilitation program. So those patients who, would choose to come in here because of the complexity of their previous issues, chronic disease, things like that, those are the types of patients, or just out of convenience. One thing that we do get from cardiac rehabilitation, these groups, the people who exercise together, it's almost like it's a social activity for some of our patients. They really get to know each other. They really become, it's a social network in a lot of ways. The staff who come in here and exercise regularly, they become friends. Not only do they become friends, but they're good support for one another. They share stories with each other. And, I had this after I rehabbed, I had problems with, blood pressure management after my exercise, or I had problems getting this, that, or the other. The patients really help support one another, so they're not just getting it from the staff, they're getting a lot of that support from one another, which is great because it is a group exercise environment, so that is nice to see.
Hi, my name's Linus Hardings, and I want to tell you a little bit about my experience at Mercer Health at the Wellness Center. Back in 2007, I had a heart attack and I had a couple stents put in. Last year in April, I had a stress test done and there was some abnormalities showed up, so the heart doctor wanted me to do a CAT scan, which I did on June the 4th. And after that, I was recommended that I do some cardiac rehab, so I started here at Coldwater to have that done. I did 36 sessions, and after that was completed and I graduated, so I joined the wellness program. What I really like about the wellness program, first of all, is the staff of people who work here, because they check you in with your blood pressure and your heart rate. They get you started, and with my exercising and working out here, I've gotten in better shape. I feel really good fitness-wise. I've lost 20 pounds, and I got to credit all of that to working out here. And back to the staff, the good thing I like about it is when I'm all done working out after about an hour, they do the same routine of checking your blood pressure and your heart rate and won't let you go until you're in good shape to leave, and I really appreciate that. I start with the new step machine, which I think you'll see behind me. I work on that for 15 minutes. Then I take a little break and I go to the treadmill and I walk on that for 15 minutes. Then I've been doing some light weightlifting in between that, and then going back to the new step machine to finish up for another 15 minutes. About an hour workout 3 days a week. The wellness program for me, as far as the family goes, has been real good. My family members are proud of what I've been doing, and I plan to keep doing this in the future. So.
Hi, I'm Renee Berkey. I'm one of the nurses here at Mercer Health Cardiopulmonary Rehab. Just to give you a little insight on what our program is about, we are about exercise and education for the patients who have cardiac or pulmonary disease. Routine exercise session for these patients will include the treadmill, the new step, and a bicycle, and some hand weights. We'll gradually increase the amount of time and the amount of intensity that a patient does over the course of days to weeks to even months. The program can last up to 36 sessions, but it's based on a patient's need. We also like to give the patient education on topics such as their medications, their home exercise, stress control, nutrition, things that will help them take care of themselves at home. It's a goal for us to have our patients comfortable when they leave here and for them to obtain their optimal quality of life and functioning at home.
Our goal is we want patients to be back to a normal, stable state of living and trying to live the best long-term quality life that they can have and improve things moving forward. Regardless of, there might be some limitations the patients have, but we want to teach them how to move forward with those limitations and be able to work around them and still have that long quality of life for many years after rehabilitation is concluded. All of our cardiac testing services require an order, so please contact your family physician or specialist for an order. Our cardiac rehabilitation services also require an order, so if you've received a recent intervention or had a recent diagnosis, please contact your specialist for a referral.